Thank you, Tom. I'm Nancy Hadley, and I'm a financial advisor with D.A. Davidson. And at our table, we have Cheryl Seifert, who is an associate financial advisor. Dee Cossey is a client associate. And two important people are missing. We have Jim Zubermuller, who's about a mouthful. He is on a business trip and is sorry that he was not able to be here. He's a financial advisor with Davidson. And Candace Nelson, who is a registered senior associate. She is at a conference today, so they were sorry that they missed this. And it is certainly my pleasure to be able to introduce our first speaker. I've known Terry since she came to town. She is the Community Development and Foundation Executive Director. I think there were a few more words to her title. I didn't quite get it all straight. She really is the public relations and the communications, and also in charge of philanthropy at the hospital. And we started a foundation a few years ago. I was fortunate enough to serve on the board. And just, you know, when you look at an economic forum and we're looking at health, I just want everybody to realize what an important component of Bonner General Health is to our community. If you think of them in our downtown area, you think of the downtown revitalization, the jobs that they provide, the people that they keep in downtown, and those people shop downtown, they eat downtown, they make a livable wage, and have money to spend in our area. And by expanding in our downtown, they are really keeping our downtown revitalized, and that money kind of goes through the community. And I think that the hospital's commitment to Sandpoint really needs to be recognized, because that is such an important role. And so, Terry, if you would let us know what's going on with Bonner General Health, that would just be incredible. Please welcome Terry Fletcher.
I'll be sure to not take whoever's notes these are, because I've been the recipient of that behavior in the past. It's not fun. Some of us wing it better than others. I would not be one of those people. I just want to say thank you so much for inviting Bonner General Health to come and speak today and to be a part of this forum. We obviously find great significant value in where the hospital is located and have chosen to partner with organizations to keep health and healthcare services primarily in this downtown corridor. So thank you, Nancy, for talking about that as well. You have to pardon me, I have that little tickly throat thing that's going around. I thought it might be interesting if we started maybe at the beginning of the transformation between Bonner General Hospital, or from Bonner General Hospital to Bonner General Health. So how many of you still call it Bonner General Hospital, or it's the hospital? Yeah, I do every day, and I swear they haven't fired me yet, but it's probably coming very, very soon. So in the summer of 2013, I had just assumed a full-time position within Bonner General and expanded from just working on the foundation philanthropy side of things to actually doing the community development. And one of the things that became my nemesis very quickly was our website. And I mean, 4- and 5-year-old data, it was just how many of you have that experience where it's not fun and every time you open it you get that little ping in your head. After a few conversations with local web designers, we did not seek any expertise outside of our community for this project. It was actually our friends at Kiyoki who challenged us to seriously and strategically consider our brand, our image, and our overall community presence in Sandpoint and kind of our region. It caused us to kind of sit back for a moment and say, oh wow, we really are talking about a lot more than just a hospital or just a website or just a logo. We really needed to have a bigger, deeper conversation. And so through that conversation, again, it was our friends at Kiyoki who said, you know, let's do a brand audit. To which I replied, a brand what? And we basically developed a plan with them to survey all of our key stakeholders. So our key stakeholders are our physicians, our staff, our allied health professionals, those vendors and people with whom we do business, and then also our community at large. And I'm sure you all remember vividly the beautiful half-page ads that we put in the D encouraging you to go to the website and take the survey. Of course you do, yeah. They're so powerful. But we actually gathered some pretty significant data, and this assisted us in several ways. First of all, it really gauged the overall image of the hospital in the community and in the region. And so basically what we heard, for the most part, were that our constituencies believed that we do have quality healthcare services available in this community and in this region. Second of all, it gauged the level of understanding of the services that we offer. And so we basically figured out that we knew what we were doing, but not everyone else understood what we were doing. Well, that can be a little bit difficult when you're working to develop service lines and bring new services into the community so as to help our patients and their families avoid the lengthy trip south or to the west. We probably needed to do a better job of talking about who we are and what we do. And then third, it really graded our current brand, and so that included our logo and our tagline. We really figured out that it was time for an updated logo, for a refreshed name that better represented who we are and what we do. So yes, we're a critical care hospital. We're a critical access hospital, 25 beds, North Idaho. We have all the same issues that face big hospitals in metropolitan areas and small hospitals in rural communities. But we're more than that. We're a series of clinics and physicians and practices and inpatient and outpatient resources. We're in Priest River, we're in Ponderay. We're really more than just a hospital. And so to complicate things, because I don't have enough on my plate and needed it to desperately become a buffet, we decided that we would go ahead and embark on a community health needs assessment. And so the assessment itself was conducted for approximately 40,000 residents represented in the communities of Sandpoint, Priest River, Sagal, Coquilala, Ponderay, Hope, Clark Fork, and Priest Lake. And so basically, again, we operate a full-service 25-bed critical access hospital, but there are many other medical services, including a 24-hour emergency department, which I will take this moment and apologize if any of you have recently had trouble locating that due to the construction project. We have new signage. We offer rehabilitation, cancer treatment through the Cancer Center on our campus. We have wound care, psychiatry, OBGYN. We do own and operate Sandpoint Women's Health, diagnostic imaging, laboratory services, diabetes education, and counseling, as well as home health and hospice services. So that's a lot more than just a hospital, right? In order to ensure that we weren't duplicitous in our efforts to conduct the community health needs assessment, I do think it's important to just share that we did enlist the help of Panhandle Health District. They had done a very comprehensive study. The data was absolutely fantastic for us and for our planning needs. And then also our local EMS group had also done a community health needs assessment. So we basically took our information, those two organizations' information, and put it all into one report. We have a group that works with the hospital and the foundation called the Advisory Council. And so we really took all that data to the Advisory Council and said, hey, can you help us prioritize? I mean, these are the influential and affluential community members. These are the people that are in the trenches, so to speak, and what I would call the resident experts. And so rather than me try to prioritize a list because I have my own idea of what's really important, we took it to that group. And so they ranked these 4 initiatives in obesity being number 1, mental health and suicide prevention is number 2, teen births, and then number 4 is child abuse and neglect. So what in the world does that have to do with a brand audit and a brand survey and economic development, right? Okay, we're going to get there. So as a result of the needs, the identification of the primary needs, and our desire to leverage our community support and our sponsorship and community benefit dollars, we began meeting with local program leaders and trying to identify how we could best, as a healthcare organization, plug into what was currently existing and working in our community. So we thought that this perhaps might be an opportunity for Bonner General to lead from the middle. We didn't feel like we needed to invent anything or reinvent any wheels. We just wanted to become a greater community partner with agencies that are already doing fantastic work here. So As a result of discussions, we are participating with Kinderhaven, PAPE, the Community Coalition for Substance Abuse Prevention. Who can say it 3 times fast? I can almost not even say it once, okay? Bonner Partners in Care, the Suicide Prevention Hotline, the Chamber's annual Health and Safety Fair, as well as other numerous health and wellness activities in the communities we serve. Things like the Long Bridge Sprint, the Scenic Half Marathon, 24 Hours for Hank, JC's Race, Celebrate Life. Anytime those opportunities come to us, where we can sponsor, we can give a little bit of money, we can offer a first aid tent and some nursing expertise. We do try to seize those opportunities, as we do see it as a way for us to help save expenses for the other nonprofits who are really in the trenches doing the work. We've also hired a psychiatrist to assist in meeting the mental health care needs in our community. We expanded the marketing and availability of diabetes and our intensive behavioral therapy for obesity program. We created a wound care clinic. We are working on the creation of an anticoagulation clinic. Our soft open for that is November 1st, so nobody can hold me to that November 1st date. It's a soft opening. We created increased awareness of our diagnostic imaging and women's imaging services. So here's the PSA for this is Breast Cancer Awareness Month. Early detection saves lives. In the event that you know someone who doesn't have insurance who could benefit from a mammogram, please have them call the hospital and get that service scheduled, okay? And thank you. And we've also taken over the full-time management and staffing of the Bull River Clinic in Knoxville, Montana. So, while these are all very health-oriented, impactful projects that we've started, we've embarked on, we're continuing to work on, we also contribute to the overall financial health, if you will, of our communities. And I thought it might be kind of fun just to run down some numbers. So in 2013, Bonner General Hospital, now Health, paid over $22,700,000 in wages and benefits. And this includes $1.8 million in first dollar services for staff and their families. What does that mean? It means that I'm an employee if I don't ski, so let's not use that as an example. If I'm walking across the street attempting to chew gum and trip and fall and go to the emergency department, I'm not going to have a bill as a staff member. It is an investment that the hospital makes in its staff. We believe we have quality staff, the best care that could possibly be delivered in this community, and that's a part of the investment that we make in our team. We received over $171,000 in contributions to help us with programs. Our BGH Foundation used only local lenders. That was the first time that had ever happened in 2013 for their fundraising and awareness activities. Our deductions from insurance, including Medicare and Medicaid, was $19,500,000. So those deductions, most of you already know. You come in for a procedure, it costs us one price to do it, but the insurance company pays us a separate price, and that gap in between is what we write off, and it's $19,500,000. Our charity care and bad debt totals were over $2.8 million, and that's in 2013 alone. So, where are we today? And I apologize, I only have numbers up until August. For some reason, the finance department wasn't really eager to just throw together a real quick report, so I get up to the minute totals for all of you. So, so far, as of August, we have paid over $16,300,000 in wages and benefits. We have received over $92,500 in contributions. Now this is the really exciting fun part. 224 babies have been delivered, 5,920 emergency room visits, 21,000 rehabilitation visits, 21,238 diagnostic imaging tests. Our deductions from insurance, including Medicare and Medicaid, are currently at $13.1 million. Our charity care and bad debt totals are over 2.1. And these are just the ancillary services, so this is the other part of health. 2,500 hospice visits, 3,700 home health visits, 5,000 Bonner General immediate care visits, performance physical therapy, increased